Experts agree that obesity is one of today's most visible yet most neglected public health problems. And unfortunately, more and more children are finding themselves at risk. But what do you do when behavioral and lifestyle changes aren't enough? We sat down with Dr. Kelvin Higa, the program director of Fresno Bariatrics at Fresno Heart and Surgical Hospital, to learn about the options available to adolescents with severe obesity.
Several issues that why we're not addressing this. And for me, it's always been a fight against the bias against the disease. Obesity is a disease. It's not because of weakness of character. It's not because we're just gluttonous and lazy. And it's clear that if we don't attack this and we don't see this as a disease, we're never going to treat the patients properly.
The American Academy of Pediatrics released a statement in October of 2019 supporting the expansion of bariatric and metabolic surgery to pediatric and adolescent groups.
So surgery is just one of the tools we have. It's really nice that we can do surgery, at least it's been proven that it's safe and effective. But for every patient that qualifies for surgery, there are hundreds of others who really need treatment as well. You know, one thing we know from studying adults, but now we're also studying adolescents with the labs consortium, is that these operations are effective, perhaps even more so in the younger population.
Dr. Higa says obesity should be addressed in the younger age groups to help prevent health and emotional issues from arising.
We know that individuals who are affected by this, they are often bullied at school and they develop a lot of other issues. And so to prevent these things from occurring is, I think, very important.
And says the first step begins with parents and pediatricians.
Parents should really refer, or physicians, or pediatricians, should refer only to centers that have experience. And not necessarily adult centers, but experience with this age group, as this is a special age group. There are special things, and it really requires a team of individuals, of specialists trained in pediatric adolescent medicine, nutrition, psychology, etc.
Fresno Heart and Surgical Hospital's metabolic and bariatric surgery program offers extensive bariatric patient resources for both adults and children.
We're fortunate at Fresno Heart and Surgical Hospital that we are authorized to take care of the adolescent group. This is a special designation by the ASMBS, our society, as well as the American College of Surgeons. And we do have a pediatrician on staff, and we have specialists who can take care of these patients.
The Centers for Disease Control and Prevention reports that in the United States, the percentage of children and adolescents affected by obesity more than tripled since the 1970s. In 2015 and 2016, nearly 1 in every 5 school-aged children and young people aged 6 to 19 years old were considered obese.
I think that we really need to attack this like it is an epidemic, and this is going to require a lot of resources.
If you'd like to learn more about Fresno Bariatrics at Fresno Heart and Surgical Hospital, visit fresnobariatrics.org.